Hi, this is Dr. Bob Dannehoffer. I'm the Public Health Officer for Douglas County, and this is one of a series of short videos that we're doing that help to explain some of the issues that have come up about COVID-19. One of the issues we frequently get is about the use of face masks. Now, face masks are a big issue because if we look at overseas photos of people in China and Japan, we see a lot of people wearing face masks. Having lived in Japan, I will tell you, face masks are a very different thing in Japan. Face masks are part of a cultural thing that have been around for many years, way before COVID-19. And it just seems to be a thing that people in Asia frequently do, even with the slightest cold or cough, or sometimes just for fashion. Face masks are not nearly as big in the United States. Now the question is, do face masks help? Well, certain kind of face masks in certain situations do help. So when we have a patient who is sick, having the patient wear a face mask and the provider wear a face mask makes a big difference. It's a little gross to explain here, but when people cough or sneeze, there are droplets that come out of the mouth. The droplets start at your mouth being fairly large and then get smaller and smaller over the next 4 or 5 feet and then dissipate. And that's why it's contagious if you're within 6 feet or so of another person who's coughing or sneezing. So if the patient has a face mask, it breaks down some of the larger particles that may go, and then if the provider has a face mask, it'll break them down further. So the proper use of well-fitting masks in a medical situation may work. However, in public, it doesn't help that much, because remember, it helps mostly for the person who has the disease rather than for the person around, so that if you have the disease, you shouldn't be out anyway. And if you want to wear a mask, if you have disease, I think that's okay, but I'd really prefer if you were sick for you to stay home. In terms of wearing a mask to prevent disease, it would only help a little bit in that the masks that you can usually get around only block a part of the particles that are out there, and thus the protection you get from it is pretty small. In addition, right now, masks are in very short supply, and I would heed the advice of our Surgeon General is please don't go out and buy masks. Leave them for the people who need them, and that would be medical personnel, EMS personnel, and dentists. Again, this is Dr. Bob Dannehoffer with another of our series of short videos on COVID-19. Thank you.